So thank you for joining. Again, my name is Jasmine Brosnan. I'm going to go ahead and present on behalf of Child Safety Forward Sacramento. This is Shifting Power to Communities. I am joined by one of our community representatives, Jennifer Mohammed. You can see Jennifer there. She's actually at another meeting, so she'll be posting in chat as we go along and has also submitted some comments that I can share with you all. Nieda, unfortunately, is not able to join us today, but she also sent some comments, and so we'll be able to kind of share their feedback as we move forward. We also have Brittany here to kind of help out and help with any of those chat questions or tech questions. I know that the resource button has been a hot thing, so check out that resource button. You should be able to see the PowerPoint there in case you need to look at it or want to download it for the future. All right, we're going to go ahead and move forward. So hopefully today, you all will walk away with a little bit of information about how to approach engaging community. This is just what Sacramento has done. So keep in mind, Sacramento is very specifically, an urban population, not as rural population. And so definitely some of these things are very specific to our community and our county. We are always learning new things, and we're happy if you all have stuff to share as well. We hope that you can gain some knowledge about community representatives and their experience with this engagement, as well as identifying some best practices for community engagement. So I'm going to start off with just a little bit of a backstory, who the Prevention Cabinet is, how we kind of came to be. So Child Safety Forward began in around January of 2019. So we got a jump start on this work kind of before all of the Family First Prevention Services stuff was really clear and out, before comprehensive prevention plans were getting started. And so we really did just kind of have a head start on some of this work. I will say that our prevention cabinet has been very systems change focused, whereas the comprehensive prevention plans are very programmatic focused, right? Doing all of those new innovative programs and changes, whereas this is a kind of a higher level conversation around changing the systems so that folks can better access all of those great new services and things. So it started back in January of 2019. A group of about 10 of our Sacramento County folks attended the summit. And as they kind of came away from that summit, they really wanted to get started with this work. So they called themselves the Prevention Cabinet and got together and started to try and find ways, set a format for developing this plan to do some systems work ahead of all of this new coming, CPP, FFPSA work. While we got started, we had kind of a rough beginning, right? I think that happens a lot of times with these really large multidisciplinary groups. But what it really kind of let us know was that we needed some support and some structure. So the Child Abuse Prevention Council of Sacramento, with the approval of our little 10-person prevention cabinet, went ahead and applied for some funding through the Department of Justice. And that's where Child Safety Forward kind of came from. So that's what makes us the Child Safety Forward Sacramento Prevention Cabinet. We are a multidisciplinary cabinet. We have more than 40 members. That's including our lead and alternates. Across 28 different agencies and organizations, and we've broken them up into 11 what we kind of consider non-traditional systems. You wouldn't normally, I think, see one for healthcare and then one for health services, but it's just kind of the way that our groups naturally engaged with one another. It really allowed us to develop this different idea of what our systems look like. So if you take a look at that wheel, you can see our systems. You can also see at the top of that wheel, we have our community representatives identified. We consider them a system that's involved with this at the same level as everyone else. But you can also see that that community parent and youth voice is at the center of everything that we do. Our vision came to be to eliminate child abuse and neglect deaths and critical injuries by 2030. This is really important because we had a lot of discussion about, what did we want to accomplish? What percentage did we want to reduce by? What were some achievable goals? And what it really came down to was only a goal of 0 was acceptable. That was the only goal that could really be motivating. And so that's how we came up with our vision. So setting the stage even further, we knew pretty much as soon as we got involved, we had our prevention cabinet started. Our planning committee became those kind of 10-ish agencies, orgs that started off. And they're the folks that help us kind of lead the work, right? They still are committed to helping us develop what the agenda is going to be. What are the things we need to accomplish within a timeline? We've also added in some of our community representatives, and having community voice at that table has been tremendously helpful. With funding also came the opportunity to bring on an external evaluator, which became a super valuable asset to this work. We'll get into that a little bit more a little later on. And then right off the bat, we recognized some foundational values that were super important to getting the work moving forward. With those came our new subcommittees. So we have very specifically a community engagement subcommittee, a data subcommittee, and a systems subcommittee. Over time, these different committees really became, the subcommittees really became an opportunity to be the work groups. They were very action-oriented. They were those opportunities with smaller groups to really dig in and get the work done, where the prevention cabinet became the larger meetings where, as you can imagine, with 20, 30 people in a conversation together, it's not a lot of action work, it's a lot of conversation, it's a lot of like voting and a lot of learning, and then these other groups really are the ones pushing those work forward. Because we have a community engagement subcommittee, we always kind of knew that that was one of the most important pieces of this work, but we'll talk a little bit about how we kind of hemmed and hawed and then eventually got there, right? Wasn't unfortunately, our first move. Our subcommittees are made up of members from our prevention cabinet. They're also made up of other members that maybe aren't members of the full cabinet, but maybe who those subcommittees said were missing from the table. We wanted these particular partners to come and share their information with these different subcommittees. Also, we'll talk a little bit later about how we have some other agencies and organizations represented in those spaces. So we have our subcommittees formed, we have our committee kind of solid, we have some funding and an evaluator. So the next thing we have to do is really dig in and take a hard look at some of the data. So we took a look at 10 years of child abuse and neglect, deaths and critical injuries, and found some pretty obvious kind of indicators, which you can see we've highlighted some of the more profound ones, right? 77% were children 0 to 5. 86% involved a biological parent, either acting alone or with a partner. And then 76% of those instances had some form of engagement with child welfare in their history. Beyond that, we did some factor analysis. We looked at a lot of other points of engagement and opportunities. So those are what you kind of see in that funnel there. But really what we looked at those, rather than thinking of them explicitly as risk factors, we looked at them as opportunities to engage or collaborate. These were the systems that needed to be here. These are the systems that were engaging with these families before these tragedies happened. How can we better engage? How can we better collaborate? How can we better communicate with our parents and families in those spaces? This data is going to kind of come back up over and over again, but definitely speaks to some of the community engagement that we do in the future. So after looking at all of that data, we kind of came out with some opportunities for action. You can see when we took a deeper dive and really got into that data, we saw our priority population of those children 0 to 5. We did see a higher risk for males in general, and then our Black and African American population was disproportionately represented. We knew that parents with young children were really the group that we needed to engage with. We did also identify some priority geographic areas. Again, these are opportunities of engagement, right? These are the places and the communities that we need to be seen in, and also the folks that we need to engage. And then that cross-systems involvement, these are the systems that we need to make sure are at the table. So you can see those opportunities for action there. We identified the supports and services that families really needed, but also that they needed to be culturally relevant and responsive to younger kids. We needed to increase access to those things, and then we needed to make sure that we were doing them in all the right places. So now we've come to, all right, we need to engage community in the conversation. We know the areas, we know the populations, we know the systems we want to speak to. Now we need community at the table to help us identify those ways to engage, those ways to improve those things, improve access, and improve trust across the board. And so we really kind of approached it and said, oh my gosh, we have no idea what to do. We want to ask community how they want to be engaged, but how do we even take that step? So for the prevention cabinet, what made the most sense was to start with community representatives. We had to just approach this knowing that we were not the expert in this area and just accepting that we were going to make mistakes, but also recognizing it was crucial and vital that we engage them before we move forward, before we create a plan, before we identify strategies. We need community at the table to help us determine how to best move forward. So in developing our community representatives, we really wanted to have them represent these larger bodies, but we also have to recognize that these are individuals, and individuals have very specific experiences, and we can't expect that number of individuals to be able to represent an entire population, right? So we knew going in, we wanted to get some information, but we also knew that this was just one piece of the puzzle. This wasn't going to be wholly representative of how we would engage community. We knew that they could give us unique perspectives on their experiences, right? One of the questions that we ask, we'll get into, but we ask about engagement in these service areas. And it's really helpful that those folks have that experience and can speak to that on a personal level. They also help us understand the why behind all of that data, right? We talk about data oftentimes, we talk about, like we said, risk factors and all of these kind of negative perspective outcomes, but we don't understand how we got there or what does that look like in a family, and how can we start to work towards understanding that further. So acknowledging that we're not the experts, but knowing that we needed to take the step, we kind of took the plunge and started developing our community engagement. So our engagement, so you'll see, sorry, that QR code in the corner, feel free to pull that up if you're interested. If you do take a look at that QR code, it's going to bring you to our application for community representatives. So feel free to take a look if you're interested. The website is also at the end, so you can go onto our website and take a look at all of these tools and resources eventually. But if you want to look right now, you can get a sneak peek. So the prevention cabinet did choose, again, to intentionally engage our community representatives, but we knew that we wanted them to bring certain experiences to the table. We knew that we needed to have those populations that we identified represented there. And we also knew, again, that this was just the first step. So we started by trying to create a matrix of different areas, different belief systems, different experiences that we wanted to see represented. What we also decided from kind of the get-go was we didn't want to say no to anyone. We knew that folks were going to come and that not everybody was going to fit into those little matrix boxes that we designed. And so we wanted to find a way that we could engage folks beyond that opportunity. So what we ended up doing was we created a whole system of reviewing and approving and all of that. But for folks who did come to the table, for example, we had service providers come to the table who, outside of their providing services, are also parents and families in our community. But what we wanted to kind of find a balance of was community versus is one experience from outside of that service provider relationship, and then a different perspective in that service provider perspective. And so what we did was opened up the opportunity for folks who worked in the service field but wanted to participate. We opened up our subcommittees and said, it's great that you want to help. We want to hear what you have to say. We know you have valuable information. However, this maybe is a better opportunity. Can you join one of our subcommittees and share your experience and the experience of your clients and all of the things you've learned in those subcommittee places, because they can really still help to inform those actions that we take individually. And so that was just one opportunity for us to kind of move beyond that matrix. We also didn't want to say, oh, well, you haven't had a certain experience, so we don't want to work with you. So we tried to find opportunities to say, unfortunately, this isn't going to work as being a prevention cabinet member. However, we're going to be doing surveys, we're going to be doing listening sessions, we're going to be doing gatherings. Can we still reach out to you? Can we invite you to some of those other opportunities to participate? So we really did kind of establish pretty immediately that no was not really an answer we wanted to give anyone. And so it's been a great opportunity to learn as those applications come in. We want it to be as accessible as possible. So we do, again, have that QR code. That QR code takes you to SurveyMonkey, and you can answer each of those questions in that SurveyMonkey platform. We knew we needed kind of a virtual entry option, and so that was the route we took. We've also printed out physical hard copies for folks that want to have something tangible in their hand. We have a fillable PDF that we could send out to different agencies. We really have tried to find every way we possibly could to make that application available so that folks can do whatever they feel comfortable and confident with. It was also a great opportunity for us to learn what were some great ways to outreach. Where were the places that we needed to put those and make those applications available? Because those are the same places that maybe we can reach out and do outreach for other programs. We also developed role descriptions. So we had some great technical assistance along the way. One of them was an opportunity to learn how to build out a role description, not only for our community representatives, but our community representatives also have a partner that accompanies them through the process, and we'll talk a little bit about that. But even having those two felt kind of a little strange that only those two people had role descriptions. And so we ended up building role descriptions for everyone as a prevention cabinet member. We have a role description for participants at the executive leadership level, which are other cabinet members. And then we have a role description for our community representatives. And then we have a role description for the partners that are engaging with those representatives one-on-one. This has been really helpful in the grand scheme also. Not only does it help folks who are interested in participating understand what to expect, it also ended up being when our community reps came to us and said, hey, we want to know how we're doing as representatives. We are here at the table, we're giving you our feedback on how things can improve, but we also want to improve and grow and develop our skills. So can we figure out a way to know what we're doing well and what we maybe need to work on? And so what we did is take that role description and kind of reverse it into this spreadsheet that they were able to then say, here are some areas where I feel like I'm being successful. Here are some other areas where I feel like I can grow. So having that role description has proven extremely helpful in more than one opportunity. In supporting our community representatives, we provide a stipend for participation. It's super vital that everybody gets provided for to participate. Our stipends are provided in advance of the meetings that they're attending. This can be challenging. It can be challenging for a couple of reasons. For those of you that work in these systems or services, oftentimes grants don't really want you to pay before a service is rendered. And so finding unique ways to work around those things, finding ways to allocate funding to support those stipends, super duper important. We found that for the grants that we've been working through, using a gift card option is pretty much the best way for us to be able to purchase those things in advance of the service. But that comes with its own challenges, right? And so making sure that the community representatives were able to get those, whether that's in the mail, whether that's picking them up physically, whatever we need to do to accommodate that has been, it's always just learning something new every day when it comes to making sure that that's available. We did also want to make sure that providing that we were providing not just compensation for participating, but also supporting that participation. We wanted it to be enough funding to help pay for childcare if childcare is needed during those meeting times. We wanted it to pay for transportation. If you need gas money, if you need bus passes, we wanted this stipend to be able to compensate that, but also compensate for your participation. It ended up for us working out to something roughly around $50 an hour of participation. And that's, dependent on your community or your county and how that works. But for us, that's what ended up making the most sense. It was kind of across the board, what everybody agreed was the best possible outcome. We also provided prevention cabinet partners. So as I mentioned, we have that third role description for our partners. We really wanted not only for our community representatives to have somebody to help them kind of navigate what it's like to attend this meeting with a bunch of executive leadership and how to feel comfortable at the table, but also asking those questions after the fact as the cabinet gets used to having folks at the table who maybe don't know all 400 acronyms that you're using or don't know what a funding stream might look like. And so making sure that they have somebody that they can talk to, but also that our prevention cabinet partners had somebody to learn from directly. Right, they're getting to experience that knowledge. They're getting to know our community representatives. They get to know that added experience of what does this look like for community, and maybe they hear from their community that, you know, navigating the webpage we set up was challenging. That's hugely important, not just for the cabinet to know, but also for whoever that partner is to know. They may take a look at their own website and say, wow, I can see how that would be super challenging for the exact same reasons. And so it really is intended to be a mutual partnership. We intentionally did not use words like mentors or, you know, whatever that might look like. We intentionally wanted to be a partnership, an equal level, everybody's learning from everybody. And so that's something that's also been very important in our process. We do have some staff support. So having that grant funding also allows for having somebody to work in the background to coordinate those meetings, but also to communicate and be in touch, to create the, you know, to email, to text message, to be available, to answer those questions, to navigate what a calendar invite looks like, or how to participate in a doodle poll, or any of those kind of techie things that maybe get taken for granted. We also developed an orientation and onboarding process. Orientation is the same orientation that any prevention cabinet member gets, right? It should look the same. We're all participating at the same level. The only difference is some added nuance around stipending and transportation and communication and things that maybe are a little bit easier or unsaid in those larger orientations. Finally, we also do check-ins with our community representatives. As we started building them up, we started with 2 and currently have 5. We asked them how they wanted to provide us with their feedback, not just in the meetings, but in their overall experience as community representatives. Again, we're not the experts. We need to learn some lessons from that experience. And so having a neutral party for a while was our external evaluator. Hugely invaluable to have that neutral party. They don't have to tell me that they're having a challenge with emails that I'm sending, right? It's uncomfortable. Nobody wants to tell that person. Maybe they haven't developed a relationship with their partner yet, and they don't feel confident sharing that. Having that outside person who it keeps everything confidential and is able to still share their feedback, hugely important. And so definitely something that we've had to navigate over time. In addition to that, we started off with our external evaluator. Now our external evaluator is someone's partner. And so we had to re-navigate that experience and find another neutral party that wasn't, you know, a partner to one of our representatives. And just, you know, exploring that has been a really great experience as well. I see some chat and questions. Do I need to check those? Good, let's see.
Looks like there's about 2 of them, Jasmine, in there. One that says, does that mean providing the good services one usually gets only when involved with a diplomacy system to all of your community? And that was in reference to the slide before this one.
It was in reference to what?
The slide before this one.
Okay, perfect. So as far, okay, so I'm gonna go back. So we wanted experience overall, right? It doesn't have to be something that you're in the dependency system. I'll show you the matrix in just a second, and you'll be able to see kind of what we call those groups. But really what they kind of broke down to is one set is considered prevention services, one set is considered kind of treatment services. We didn't want to get super personal and say, are you receiving services from this specific agency or organization, or do you have history with this service? We didn't want to get that in depth because it wasn't super relevant. It was more relevant that they were able to have experience trying to receive a service or having received a service or even being required to receive a service. And what did that experience look like? How did that work? How did that feel? Or maybe it's even somebody saying, look, I looked everywhere for this service and couldn't find it. So we want anything across the board as long as it was kind of engaged in these systems that we were looking to provide systems change. All right, second question, which partners work in the field that can nominate someone that would make a good part of this work? So I'm going to go ahead and show the matrix, and hopefully that'll help kind of identify the answer to that question. So what we did as far as looking towards our community engagement, we took that data that we had looked at before and said, from this data, from all of the things that we've learned, who do we need at the table? Again, none of these are intended to exclude a person, right? Just because you say no to these questions doesn't mean that you're not welcome to join. It just means that this is the level of diversity that we want to see at the table engaged as in our community representatives. And so you see, you know, just generally what's your zip code, what area do you live in, what does your community look like? Is it one of those zip codes that we saw in our data that we knew was overrepresented in child welfare or with deaths and critical injuries? Are you available and committed to this? Can you do this for a year? And I'll share a little bit more about how that shook out too. Do you have experiences as being a mother, being a father, being a grandparent, being a caregiver of any kind? Do you have experience being a teen or young adult with pregnancy or parenting? Is there some other form of caregiving that you've provided that we haven't thought of? You see, our examples are the ones in parentheses. So were you maybe a sibling to someone? Were you, maybe a foster sibling to someone? What does that look like? We were looking around for race and ethnicity. We know, like I said, overrepresentation in our Black and African and American folks. Do you have experience with the foster care system? That can be, were you a foster child? Have you been a foster parent? What is, any of that can be relevant to this conversation. And then second languages, system of care experience, that's where those prevention versus treatment. On the application, it lists out a bunch of different services. So for example, in our prevention, family resource centers, government aid or benefits in that regard. When it comes to treatment, we're talking about like substance use prevention and treatment, child welfare, probation, any of those types of systems. So I mentioned that we do check-ins with our community representatives, and I just want to share, I know that's a lot of words on the page, but I just wanted to share a couple of examples of some of the feedback we've received from our community representatives. So our reps told us that in the beginning, they'd like to be checked in with quarterly, so every 3 months for the first year that they were representatives. After that, they felt like we could probably go every 6 months and kind of share as we move forward throughout that process. And the only scripted questions we have for those check-ins are the first check-in they do. We ask them about their recruitment experience, their experience interviewing or coming to the table, their experience and engagement, and their orientation and onboarding process. And so those are the only kind of really scripted questions that we ask. Otherwise, check-ins tend to be topical. So if there's something that we're about to embark on as the prevention cabinet, we might ask, are there some things up front that you want to share about that? Or for example, we're working on developing a logo for Child Safety Forward. We wanted our community reps feedback with that. So during that check-in, we say, okay, do you have any just immediate feedback that you want to share about what in a logo might be beneficial for the community to see? And so asking things like that. In this example, you can see we get some comments around our recruitment. We can do a better job of reaching out to certain specific agencies and organizations. We were happy to see that the material was informative, but we also know that there needs to be more, right? It touched on some key things. but it didn't cover everything. And so we need some additional information. We want response right away. We just submitted an application. An application of any kind can be intimidating or scary. And so wanting to be in contact within 24 hours is not too much to ask for that, right? So just acknowledging that we need to get back to them as soon as possible. When talking about interviewing, going through the interview process, what does that look like? How can we make that better? They want to, so what did we hear? They want to be a part of that process. Our community representatives want to be there for those first meetings with potential members. And what does that look like? And then how can we improve our engagement? We have to take our time. We have to make a concerted effort to make the time available for our community representatives to speak up, right? You saw that we have a 40+ membership. That's a lot of people trying to talk about these topics together. And so making sure that we are being intentional in opportunities to get our community representatives to share and providing that platform while they're still learning and still going through that process together. So definitely some feedback that we take seriously. So here's some information that we heard from our community representatives. We asked them, what is it like to be a part of this, right? And so I just wanted to give a couple of examples. Again, I know a lot of words on the screen. You can download that PowerPoint and read them all again in more in detail. But just knowing that we're helping folks to feel empowered in their communities is a huge piece of this puzzle as well. We didn't want this just to be, what is the prevention cabinet getting out of community representatives, but what can our community representatives get out of this experience? We hope that it helps to build leadership. We hope that it's something that can be added to a resume. And so these are things that they shared as being a positive. I see a hand up.
Yes, is this a good time to ask a question, or do you want to go through the?
No, go ahead.
Okay, thank you so much. I had put in the chat a question around who was all involved in creating the community engagement matrix?
Great question. So the data that was shared at the very beginning, that 10 years of data, was shared with the entire prevention cabinet. It's a part of our orientation and onboarding. We want everybody to know coming on board that this is the community and the population that we're working with. It was our community engagement subcommittee who took on the work of building out our application and determining what that membership needed to look like. And they were the ones that basically came up with the idea of, we want to have, the matrix needs to be inclusive of all of those folks that we identified in our data. So it was really our community engagement subcommittee that determined that those were the best things to put in that matrix. The idea for a matrix came from a different technical assistance provider, and I will put that in the chat at the end. It was something that we learned from someone else, and for them, it was a tool they utilized for building like a parent advisory board, and they wanted to know, who they needed at their advisory board to be complete. And we just kind of adopted that into this and used it for our own purpose. But again, the biggest piece that we have to emphasize is that it's not so that we say no to people. It's something to make sure that we're inclusive of people.
Great. And then the second part of the question was, how did you decide on the stipend amount? Here, I saw you had $50 for your participation. So what was the process that y'all utilized to decide the amount for the stipend?
Yes, another great question. So we really just asked folks that were already doing this work with other people in the community, whether that was advisory boards, whether those were leadership groups. A lot of the agencies and organizations that were at the table were already doing that type of stipending. We also, again, took into consideration, what does it cost for an hour of childcare? What does it cost for a bus pass to get across town to come to our agency for an in-person meeting? And so taking those into serious consideration as a part of that conversation, it's how we came to that amount. And again, we say it's $50, and it comes out to about $50 an hour. we don't go back to our reps and say, look, that meeting ended early, we're gonna deduct this amount. That's not how it works. We're committed to providing that amount because that's the expectation of participation. And just like everybody else at the table, they spent exactly the same amount of time there. We want to compensate appropriately. So we're not taking funding back, we're paying in advance so they can hire that babysitter and they don't have to fork over the money ahead of time. We've already given them the funds to support that bus pass, to support that caregiver, to support whatever that need is prior to that meeting. Paying for technology. We do Zoom meetings now. We have to make sure that everybody has access to a Zoom platform. Like, those are important things. And we want to make sure that folks have that in advance. Any other questions while I'm kind of paused in the middle here?
Thank you.
Oh, yes. No, my pleasure. Thank you. All right, I'll move us forward. So with community representatives onboarded, now we wanted to pursue kind of the larger picture, right? We had community reps, but we identified that those were folks with individual experiences. They don't represent their entire community or the entirety of Sacramento County. So how can we get some more feedback to the table? The prevention cabinet really was leaning towards doing some community listening sessions. And what we found was we came up with this plan, we came up with some ideas, we developed kind of a protocol, and then we said to our community representatives, hey, can you take a look at these? Can you help us understand what would, not only like what questions are appropriate or how can we better phrase these to be more accessible, but also how do we approach folks? How would you feel comfortable in a room sharing the answers to these questions? What does that look like in the bigger picture? And so our community reps were, of course, incredibly helpful and super supportive of the process. And even, we also use this as an opportunity to engage new community representatives, right? We're out there talking to community. This is a great opportunity for us to market what we're doing and to invite all of these folks that participate to the table. What you see on the screen are the questions that we asked of each of these groups. Some of the kind of really key things that we learned in our listening sessions were we were always very supportive of providing everything up front. So when folks would register to participate, we would immediately send them the PowerPoint that was going to be presented. The PowerPoint had the questions, it had all of the slides, it had everything we were going to talk about. So there were no surprises when we came to the table. But it also came with a few slides that had supportive services. It had mental health hotlines. It had these other folks that they could reach out to in the event that this kind of triggers or brings up some different experiences for them. Maybe they didn't know that that was going to happen until they came and tried to answer those questions, but we wanted to make sure that everything was transparent. We were upfront. This is what we're going to talk about. These are the questions you're going to be asked. And so we really tried to allow for that, that space. We did do one in Spanish and English and had folks at the table who were able to help translate and work through that process together. And so we had the PowerPoint completely translated in Spanish, and we're able to provide that again in advance in those situations where that was needed. Beyond that, we also really tried our best to have the host agency, whoever it was that we came to, co-facilitate with us or facilitate the question asking. This was a trusted person, and this was somebody who had experience with these folks that we were inviting to discuss some of the more challenging things in their life. And so having a trusted party there to help facilitate that conversation and to create a safe space was super important, and having that that backup and that support person, but also it was somebody that they could talk to after the fact, right? If they had more questions, if they needed follow-up, they had that supportive person who was also there with them that they had access to. We did these in some of our family resource centers, some of our community incubator leads. And so we were able to go and specifically touch each of those areas, those zip codes or and communities that we had identified in our data. But beyond that, we really just tried to keep it open to anyone who was a parent or caregiver of any kind of in those areas, and gathered a ton of information. I'm going to show a couple more slides. Again, super, super wordy. I highly recommend going and grabbing the PowerPoint and reading them later. But I always, our community members have shared so much information with us that I feel like it's doing an injustice that we don't share that information with folks. So these are just a couple of the comments and things that were shared with us as a part of those listening sessions. But yeah, I mean, folks were so open and were so willing to share. We did kind of see different themes based on the conversation across the communities. But overall, when all was said and done, and we talked to these 42 parents and caregivers across these 7 different areas, we really did see a lot of the same themes that we expected and anticipated. But we learned so much about how to better engage, how to better be accessible to families. And so again, these are just some of the amazing things that were shared with us, some experiences that are not always positive, that remind us that we have a lot of trust building to do, that we don't need to keep coming and asking the same questions without having some answers to the questions they've already answered, right? And so it was a very eye-opening but overall positive experience for us. Coming out of that, to boil all of that information down to really, really basic, our listening sessions gave us kind of 2 calls to action, right? We need to promote prevention to ensure that our thriving communities, and we need to improve our service delivery to empower families. There are a lot of reasons that these were important, and we, because we had an amazing external evaluator, we're able to capture all of this information and kind of synthesize it into this snapshot look. But there were, beyond these, individual call outs to agencies and organizations, but in the big picture, they were relevant across all of our systems. I feel safe when I get a resource from the library. That's super important. I don't feel safe sharing my experience because I feel like it's immediately going to be reported to someone else and I'm not going to even get the service I went for in the first place. Super important across the board. It doesn't matter who you are or what your agency or organization provides. That's feedback that we need to take into consideration and work on as a community. So we've got all this information, we've got our community representatives, we've got our listening session feedback. It all gets embedded into the work that we're doing in our Child Safety Forward Prevention Cabinet work. This is what our theory of change looks like. You can see our foundational values there on the side. Again, super important to have community right there at the beginning. You'll also notice that last bullet, which is the well-being of children and families, it's the 4th bullet. Health and well-being are critical. Be mindful of self-care by prioritizing your mental, emotional, and physical health and well-being. That came from our community representatives and them sharing that this was something that needed to be identified in the role description. And we kind of, as a subcommittee and community engagement, said, that's super important for everyone. That's not just something that our community representatives need to be mindful of. It's something we all need to be mindful of, and made its way into our foundational values. Our strategies mirror our values, which is super important. They also mirror that data we talked about. So while we identify diversity, equity, and inclusion as a whole as a foundational value, it's our racial equity that is a strategy we need to focus on when it comes to our community and what the data has shared with us, as well as our community. And then you see, of course, our vision of success. You see our vision there with our eliminating child abuse and neglect, deaths, and critical injuries by 2030, but also what it will look like when we're successful in doing that. So after having several years with our Department of Justice funding, we did take a look back at that 4.5 years of work and really identify some of our lessons learned. The obvious one that kind of pops out is that centering community voice. That's what we're here talking about and sharing. But I did want to leave up all of them because they all had a piece of that puzzle, right? Having our operational structure with our community engagement subcommittee was so vital to taking that step, taking that leap of faith, and continuing the journey with our community engagement. Leveraging our countywide collaborative efforts. We wouldn't have had our listening sessions if we didn't have agencies and organizations willing to partner with us, to work with us, and to help recruit and to help co-facilitate those conversations. Beyond that, having everybody in our prevention cabinet coming to the table, always being ready and willing to participate, to being still active and still totally invested in the work after what we're looking at more than 5 years now. Is just so super vital to the success of this. And then we've talked a lot about our external evaluator, but having a neutral party, but also having someone capturing all of that work you're doing in the background that you just maybe don't think about or don't have that opportunity to capture. Having someone who's there to capture and reflect that back is so super helpful, and has definitely helped us with our community listening sessions, with our community engagement, with our check-ins, with all of that work. It's just been a huge, vital, and important piece of that process. So even though it's only centering community voices, that one lesson learned, they all had a part of that same process. So next steps for Sacramento County. Again, we've learned a ton of information from our listening sessions, from our community representatives. We owe it to all of them to continue to show them what we've done with that feedback. We have been really clear that nothing that we do, we don't want it all to be one and done, right? We want to continue to develop our work and continue to bring back that answer and say, here's what you shared with us. Here's what we have done with what you've shared. Is this, did we do it right? Did we get it right? Did we get it wrong? How can we continue to improve this? And what's the next priority? What's the next super vital or important thing? Is it something you already identified in those previous sessions? Is it something new that's happened in the community that you want to highlight, or that's super important in maybe your specific community as opposed to Sacramento County as a whole? So we've heard feedback from our community representatives. They want their own opportunity. They want their own subcommittee. So our community representatives are going to have their own subcommittee, and we're going to help them by supporting the work that they want to do. They are in high demand. We get requests from other agencies and organizations saying, hey, we know you have some community representatives. Can we ask them to come to this meeting? Can we support them and have them give us feedback on this flyer or this new project? And they're always super willing and ready. But it also is, it would be a little bit more empowering to say, why don't you come to our meeting? We're going to have a meeting. You can ask to come be invited to our subcommittee, and then we can have that conversation in our space where we feel comfortable and confident. We're always striving to get towards that community-led, community-owned pathway, which isn't always an option, right? It's not always a possibility, but we do have that opportunity with our community representatives. And so we want to support that ownership as best we can. We know we need more members. We have some great members. We have members with longevity. We have folks that have been with us for 2 years, which is amazing. But we also know that we need more, and we need more information. We need more community representatives at the table. We need to finish that matrix and make sure that all of those different experiences are represented within our group. Community gatherings are our kind of response to community engagement. So making sure that we are bringing community back together to say, here's what we learned, here's what we did, what's next for us? What do we need to work on next? So that's our kind of next big adventure with community, is having those gatherings, having that opportunity to share what we've done with what was provided, and being able to move forward from there. Cross systems initiatives and collaboration. We want to make sure that everybody has the same great experience, and we want to make sure that folks are able to engage community in all of their projects, but we want them to engage in the best way possible. And so we're out here sharing as best we can, making ourselves available to anyone who's interested in having conversations about this. We're happy to share what we've learned. We're happy to provide whatever information is valuable. Like I said, I'll give you the website and info. You can go and look at our role descriptions. You can look at our application process. If you have questions, we're always available. We're happy to come and do a training. We're happy to come and provide whatever we can provide to make sure that those engagements with community continue to improve and grow. We also know that, again, we're still learning. We still learn things that we are doing maybe not right every single time. And so just making sure that we're open to those learning experiences, but also seeking out those opportunities, right? Sometimes it doesn't land on your doorstep. You have to go looking for it. So acknowledging that we're talking about Sacramento County, which is a very specific type of space. We have plans to go into our rural counties and ask some questions and say, this is what's worked for us. How might this look different for you in your community? How might it better be formatted to suit a rural environment? What does it look like for confidentiality in very small cities and towns. You know, those are some challenges that we still are learning about and things that we want to continue to learn and improve upon over time. All right, so now for what everybody is probably waiting for. We did have some questions. We have community representatives that are here. So Jennifer is on the phone. She said she can share via chat. I know she's in another meeting and she's just kind enough to be here with us. But they also, 4 of our reps provided some written information as well. So Jennifer, I'll let you kind of start if there's something in the chat you want to share. But we're going to start off with question 1, which is, what's some advice that you would share with someone who wants to engage community representatives? I'll let you write in the chat. I'm going to read off some of the responses that were written for us. So let's see, I would say the trust in the overall strategy to eliminate child abuse and build community is absolutely essential. Many communities that come into contact with government agencies are often distrustful and paranoid of any communication. I would say be a good listener, respectful, and non-judgmental. As a community rep, it's important to stress that we are not government or agency officials, and that my overall goal is to assist in getting services where needed in the community. Create partnerships, remain engaged, stay visible with your communities. We also heard, I would tell them it's great. It is a great community to be a part of. You'll be in company with amazing people and who help you with what you need. They'll welcome you and they'll also be an awesome and beautiful, being with them is like being with family. Families could meet someone that they have something in common with and possibly befriend someone that they can talk to and be a support to someone that they can depend on. Caregivers, you can also meet a caregiver that can change your life or become a part of your family, someone you can go to for advice or can give you a resource that can help you. Someone your children can attach to, and someone to love your child. Jennifer, I see your chat. So always be open-minded when speaking to community members. If they're not interested in joining, then do ask if anyone they know might be interested, and also make it clear regarding what it is they can expect when they join for example, assigned partner and what the goal of the team is. Question number 2. Why have you stayed engaged after 1 or more years as a community representative? I love that we can ask that question. One answer, the work is so rewarding. I believe my position on the cabinet is one of the quickest ways to be a positive impact in the community I love so much, and which welcome me with open arms. The cabinet also gives me access to important decision makers and allows me to provide a perspective that may not be so easy for agency leadership. Maybe you're a month or 2 away from being a year on the cabinet, but I love making an impact to the community and love the support to contribute my thoughts and input to organizations, programs, and systems that have the ability to make change. The reason I've stayed as a community representative is I love being around people that are smart and informative. I love learning from intelligent people and people that are passionate about helping kids. I also like connecting with the other representatives. Jennifer is in the chat. I have stayed engaged due to multiple reasons. Firstly, because of the fact that the prevention cabinet aligns with my goals as a parent leader, and knowing that a parent leader, my opinion matters and is always heard. And lastly, because there's continuous improvement to better the life of children. What would you like to see done with community engagement? What would you like to see done next? Sorry. Continuous discussion with the cabinet on the ongoing landscape of children and family services, continued assessments on promotion of services and latest technologies, ongoing reevaluations of systems in place, careful review of data and applying action. Giving community members an opportunity to contribute their inputs, not just during the cabinet meetings, but also in actionable work before and after meetings. What I would like to see done next is the community visiting preschools so they can get an idea of what the parents need for support and spend time with the children. And Jennifer says, I'd like to see our current parent representatives sharing their success stories with the community to allow more community leader involvement. And then I asked our reps if there was anything else they wanted to share regarding community engagement of any kind. And they said, I feel so fortunate to be a part of the cabinet and appreciate my fellow cabinet members' commitment and expertise in their dedication to community service. Utilizing the knowledge, skills, and experiences of community members whenever applicable, consider in-person or virtual activities for community reps, lunch and learns, etc. And I would like to thank you for welcoming me into your community. I've learned a lot, and being a part of your community has helped me be a better person. You are all superheroes to me, and I hope you continue to protect our community. And then Jennifer's, to have current parent representatives suggest individuals who they know and think would be a good addition to the work being done. Thank you so much, Jennifer. All right, so I think we have a little bit of time left. And so I just want to open it up. And if anyone has any questions, I'm going to move to the last slide, which has contact information. So that's me, my email address, phone number, and that's the website you can go to if you are interested in seeing the application, the role descriptions. There's descriptions of our subcommittees on the website, all kinds of stuff on there. So definitely go explore, utilize those things. But if there's something that you're not finding there that you wish was there, let me know. We love getting that feedback. We want it to be an accessible place for anyone to go and look for information. So if you're looking for something specific and you're not finding it, we would love to hear that feedback as well. I'm going to stop sharing my screen so I can see everybody. Any questions, anything you want to know? Jennifer is still here and can communicate via chat. So if you have a question for our community, I'm sure they'd be happy to help as well. I pulled up my Q&A. So were schools a good recruitment option, and how did you address the ongoing concerns or challenges of communities that need help but were not represented or at the table? Yes, we've had schools recommended to us several times. We do have some folks from our County Office of Education on the prevention cabinet who are always willing to help us do some of that outreach, do some of that work to communicate with families. So yes, to some degree, we do have some options as far as outreaching to schools. I know that our community representatives are very active in their schools. Some of them are, a part of their school district meetings. Some of them are, in parent leadership in that department. So I know that they also reach out to the folks that they know and let them know that these opportunities are available. Again, we try to be as accessible as possible. So hopefully it's just as simple as here's the website or here's the QR code. But we also try to make those physical copies of things available. So if they want to hand those out to people, they can do that as well. Addressing the ongoing concerns or challenges of communities that need help but are not at the table. So that's a tricky question, right? We don't know who we don't know. So for us, our primary focus has been utilizing the data we have available to us and focusing on participating with communities that are identified through our data. Does this mean folks get left out? Absolutely. Everything we try to do with targeted universalism in mind, meaning what we do to help any specific child in our community, hopefully is helpful to all of the children in our community. And so we do try to help navigate in that perspective. But yeah, we really count on our community to help us understand what's missing in a lot of these spaces. We also do try to be honest about what we can do, how often we can be out in the community. And we also don't want to fatigue our community. So we're often trying to collaborate with other initiatives that are ongoing so that we can come together and participate jointly on some of these processes. So our listening sessions, for example, we did in partnership with our Family First Sacramento, which is the designated group working on the comprehensive prevention plan. So we got together and we did a lot of this work together, and we developed those questions together, and we shared our findings. And we did that all in hopes that we wouldn't have to have two different groups coming to the same communities, asking the same questions and not connecting the dots, right? We all want to be on the same page. We all want to make sure that the strategies we're doing are useful across the board. And so that's the best way we try to collaborate and capture all of those missing links. So do parent leaders help parents navigate community services? Great question. That depends entirely on the agency and the service being provided. So in Sacramento County, I know, for example, our family resource centers have a parent advisory board, but they don't have what is traditionally known as like a parent partner. At least most of them don't. I don't know if some of them probably do at this point. So I know that some do. I know that there are some great things happening in our child welfare with some parent partners and some parent leadership in that regard. So definitely there are some options out there. As far as the prevention cabinet goes and our work, we're really focused on informing the group to make that systems level change. So we're not really there on the ground with our programmatic level change. What funds am I using to provide stipends, and how are we drawing that down in advance? So great question. Definitely a challenge, right? So luckily for us so previously we were funded by the Department of Justice, and the way they allowed us to do that was purchasing gift cards in advance, allowed us to give those gift cards in advance, right? So we were allowed to purchase them for parent participation, and then we would send them out in advance. What we could not do, and what oftentimes grants won't let you do, is like add them to payroll or cut them physical checks. So we try our best to make the gift cards and things accessible. So we give Visa gift cards. They're usually pretty accessible to use, whether that's virtually or in person. We provide them in different denominations so that folks can utilize them in different capacities. We try to be as flexible as we can. We do pay a cost for that, right? Purchasing a gift card has its own cost, but there are some sites and some different folks. If anyone's ever used vanilla gift cards, a website, they do some discounted bulk purchases of cards. So you can reduce that as opposed to paying for, like the $5 service fee you pay on Amazon to buy a gift card. So definitely some tricks of the trade, but unfortunately things like doing a payroll check is just not an option with most of our grant funds. Are we partnered with domestic violence groups? So we do have some folks from a domestic violence agency at the table. One of them happens to be also on our community engagement subcommittee. But we definitely are open to anybody to participate in any capacity. When it comes to our prevention cabinet and joining the cabinet as an agency, our request is that the lead person is a person in executive leadership. And then their alternate would also need to be a higher level of leadership. This is because, again, we're focused very specifically on systems level change, and we need folks at the table who have the ability to make that systems level change. And so that's why we've kind of limited our leadership with our organizations. As far as parents and community representatives or listening sessions, we're absolutely open to that. We did have, coincidentally, one of our listening sessions was very focused on a domestic violence experience. And so we did hear a lot of feedback about what it's like to access that type of service, what it's like to feel uncomfortable saying or reporting certain things, lots of conversations around safety and the need for services without having to be in crisis first. And so we did have some really great conversation about what that looks like in our community. Any other questions? I see some of our reps are writing in chat. Thank you guys so much. I was a trainer in a former life, so I'm fairly comfortable with silence, but if you have a question, feel free. You can pop it in the chat. You can also, I'll put my email in the chat as well, so you all can reach out to me. We are always happy to, if you want us to come and have a conversation with you or your agency, if you want us to present what we presented here to somebody else, we're always happy and willing to do that. We're also, like I mentioned, we've utilized some other services and some other technical assistance on our journey. I'm always happy to share that, but I always want to make sure that I'm sharing the right information and the most current. So I'll go and check and make sure that I have the most current version of that. You'll also hear from one of the people, I think tomorrow, Junius Williams will be here, one of the absolute, best mentors in this field as far as learning about what it looks like to engage community at that ownership level. And so definitely a lot to listen for tomorrow when you get to hear him speak about some of that as well.
And Jasmine, it looks like we have another question in the Q&A. What about children with disabilities?
Yeah, so that's a great question. And honestly, it's a territory we haven't really ventured into yet. I will say we do have some great services, and we've talked about inviting someone, I think from Alta Regional, which is our kind of regional provider. But for now, most of our engagement around that has been with our school representatives and that level of representation. We do more recently have someone tribal representation at the table, which has been one of our new additions, as well as United Way, having a bigger picture of what that looks like for engagement, having United Way join our table as well. But yeah, so definitely something for us to continue to learn from. All right, well, I won't hold you guys here. I know we're all headed back to the main room. I assume it's probably already open if you all want to go back there for closing. But again, my email's in the chat. If you have any questions, feel free to reach out to me later. Thanks so much for being here, everybody. Thank you, Jennifer. Thank you, Junior. I saw you. Thanks for being here.